Hi everyone, I'd like to welcome you to the Medical Laboratory Science Info session. Today's information session will be presented to you by Emily Frawley, who's faculty here at BCIT. Before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. Today, we're going to go over who we are, what the program is, and then we'll open the floor to some questions and answers. I'd like to welcome Emily Frawley, who's faculty, Jennifer Elliott, who's the Associate Dean, Donna O'Neill, who's the Clinical Coordinator, Maninder Desi, who's our Program Advisor, and Darren Ton, and myself, Marketing Coordinators, and my name is Julie. At this point, we're going to pass it over to Emily Frawley, so I'd like to welcome Emily to continue to start off her presentation on medical laboratory science.
Hi, everyone. I'm Emily. I'm one of two Emilys in the department. I teach into the level 1 classes in a course that we call Integrative Studies, which covers a lot of the introductory material that you will see later on in your further level courses and then in your clinical placement. So this picture you're seeing here was taken in 2019. We have a National MedLab Week in April, and we managed to get together before the 2020 pandemic closed everything down. And this is our class of roughly, oh no, this is level 1s and level 2s. So this is roughly, not everybody turned up, but there were 160 people with our program at that time, in addition to instructors and other faculty. So this is the size of the group you will be working with in our program. So this is an Indigo Lab Coat. It was a awareness campaign that was put out last year by the CSMLS, that is the Canadian Society for Laboratory Sciences. That's our professional organization. And for the if you look at it at this distance, it looks like a single color. But if you look very closely in microscopic font, you can see the name of lab tests. And that's are all the lab tests that are performed each day in Canada. So how many lab tests do you think are printed on this coat? So we're hitting it. Most people are falling on the 1.2 million, and most people are correct. So there are a lot of laboratory tests that we as medical lab techs perform, 1.2 million each day. And this is just a very, very small font print of some of the tests that we do. We go to the next slide. This is a video from WorkBC that is put out to let people know a little bit more about lab sciences, and we will run that and let you watch that for a little while.
Our next career plays a vital role in the field of medical science. We're in the lab today to meet a medical lab technologist. Hi.
Hi, I'm Jody.
I'm Brian.
Nice to meet you.
Nice to meet you.
Let's get a lab coat on and get you started.
Great.
My name is Jody Simmons. I'm a medical laboratory technologist, and we're at the Dawson Creek and District Hospital lab. Medical laboratory technologist works in the lab. They run patient samples, blood and body fluids. They're tests that are ordered by a doctor, and we run them on instruments, and we make sure that those results are accurate and precise before we release them to the doctors. A typical day would involve coming in and waking up all our instruments, and then we would have to pull quality control material to make sure that our instruments are running correctly. We would be doing any maintenance, like pulling apart the instrument and cleaning it before we would want to run any patient samples.
What is this machine?
We're looking at the inside of a chemistry analyzer. So when someone, for example, comes in the hospital with a heart attack or a suspected heart attack, this is actually one of the instruments we use to see if there's been damage. So you're always learning about new instruments. Your day is always different. Your day is never the same. You might be learning a new instrument, a new technology In a small lab like this, we are required to draw blood sometimes, so we'll draw the blood and bring it back to the lab. We're looking at tubes, and I'm going to tell what this person's blood type is by using my reagents and these tubes. So if you're an A pos patient, or if your blood type is O, I'll be able to tell from these tests.
Okay.
You're putting drops in tubes, and you're using pipettes and small equipment, and you're doing maintenance, so it's good to be able to work with your hands. It's good to be very organized, so you can organize your workflow and compartmentalize, because you have priority specimens as well. You might get pulled from one thing and there's a stat that comes in and it's a lot more, has priority over a routine sample, and you need to stop what you're doing and work on that stat specimen from the emergency, for example. Always double check your work,
Sure.
so you do not want to make a mistake. This person's bleeding in the merge and they need blood quickly. You need to work quickly but accurately as well. I don't think people realize how closely we work with other healthcare professionals. We work with nurses and doctors quite a bit. So the centrifuge is slowing down. It has spun the two samples together. So basically my patient's cells have just been spun. But if you look here, this is my tube. That there is a blood clot. That's a agglutination of a patient's cells.
So because the blood clumped together within this solution, you know that this is what type of blood?
This is an A person.
Okay.
Because I put A reagent in and the blood clumped, you have an A person. We work shift work, so we have day shifts. Our day shifts start at 7:30 to 4, and then we have a person coming in at 2:30 till 11 o'clock at night, and they're our evening shift, so they're on call all night until the next morning. I was interested in chemistry and biology in high school, and then I went on to get a university degree in biochemistry. There is a degree you can get for medical laboratory technologists, but I have a certification and it's a diploma, so it's a 2.5-year program. The advantage of having a degree over the diploma is you do get paid extra, and you can also take a management position a little easier than that. But the diploma, everybody is certified. You take a certification exam, and everybody is considered certified, and you can work anywhere in Canada. There's always opportunities to further advance your education. You could specialize in another department like microbiology. Also, the CSMLS, which is our certifying body, offers courses online that you can take and further advance. My advice for somebody straight out of school would be to go and do a lab tour, talk to somebody that works in a lab. A good medical laboratory technologist pays attention to detail. They're considerate to others. They really do care about the well-being of people, even though you're not in the forefront and people don't always see you. It's nice to know that you're having an impact on somebody's life.
Jody, thank you so much for showing me around.
Nice meeting you. Don't forget to wash your hands.
You got it. Thanks.
Bye.
Once again, I'm Brian for Career Track, reminding you that this career could be yours. See you next time.
Right, so that was telling you a little bit about what a day in the life of a lab tech looks like. In Canada, as we talked about earlier with the Indigo Lab Coat, we run over 1.2 million lab tests, and doctors use these tests to make diagnosis. The CSMLS had a slogan a couple years ago that said, "Without us, you're just guessing." So we're the people behind the scenes that are making the results that the healthcare staff bases their decisions on. What you're seeing in this picture is a couple of our students in our histology lab. One person is cutting tissue, and I think on the other side, he is looking at it under a microscope, and then there's one more person working in the hood in the back. So we are a 2.5-year program. It is full-time, in person, and you come out of it with a diploma and the qualifications to write the national exam. As part of that 2.5-year program, there is a 35-week clinical placement as the end chunk, and you will be placed in a hospital or a lab setting anywhere across the Lower Mainland. We work with Interior Health, we work with Island Health, anywhere across BC. So there is a large demand for medical lab professionals. And when I say large, I mean our program admits 96 students every year. We've just expanded up to 96. We are barely keeping up with the vacancies out in clinical. So we are in hospitals, in community and private clinics, in blood banks, in research facilities. And recently, the Prime Minister of Canada praised us for effectively managing the COVID-19. So any of the PCR testing that you hear about, that was us. We are by far the largest program in Canada. We have 96 students, like I said, and we are the second largest program in the School of Health Sciences at BCIT. Nursing edges us out for first. Like I said, it is in person. We have all of our lectures and labs here on the Burnaby campus. The labs are quite hands-on, and you will be in multiple labs over the course of your term. And then when you are confident working in a laboratory situation with samples here at BCIT, then you have a clinical rotation of 35 weeks. As I mentioned in the video, there are lots of different sites to go to, and shift work is part of the clinical experience. Patients don't pick when they need their tests run. So we are a 24/7 professional, or 24/7 profession. There's somebody there at stat holidays. On the weekends, we're always there in the hospital. You will not necessarily need to do shift work as part of your clinical. And on your clinical, you are responsible for transportation and your accommodations while you're on your clinical placement. As part of the placements, we try our hardest to get people their preferred sites. The way it works is that you will submit your 3 favored sites, and a computer algorithm is going to work out who gets assigned to what slots. We cannot guarantee that you will get one of your preferred placements, but we do try our hardest to get people into the slots that they'd like to be at. I will say that if you are choosing a clinical site outside of the Lower Mainland, so if you're from the island and you want to do your practicum on the island, your chances are higher of getting into one of those slots. Career outlook is great. Our students have 100% employment when they leave our program. Quite often they end up working at the hospital site they do their practicum at. The new positions are always being created, and a lot of people are retiring. So we are just barely keeping up with the open positions that are out there. Median salary tends to be around $35 an hour. And right now we are so hurting for people that a lot of sites have started offering signing bonuses. So that is a possibility now with the shortage in healthcare across the board. So a day in the core lab, this is Jackie, one of our students, originally from BCIT, and he is showing another one of our students how to use an automated urinalysis instrument. Quite often, our students, once they graduate our program, pass the CSMLS, are working in their clinical sites, they go full circle and end up teaching incoming students. I've finally been in the program long enough that now some of my coworkers that are teaching at BCIT were students of mine from when I first started, and it's an odd but delightful thing to see them come into our program and teach, and the cycle continues. This is Joey. She was a level 1 student last year, so she's a level 2 student with us this year. She was able to come last year and talk to you about her daily experience in the program. Unfortunately, she wasn't able to make it to the info session this time around. Julie's got some of her notes from her presentation last time, and I'm going to hand it over to Julie briefly to go through those.
Hi, everyone. And this is a couple of statements from Joey about her experience at BCIT. So far, my experience as a MedLab student has been a little difficult, but it has been rewarding. It has been very refreshing to be able to get a lot of hands-on experience in laboratory courses, especially since I am used to only learning fundamental theory in my undergraduate studies. Every day, I am being taught invaluable skills and knowledge that will eventually be translated into the clinical setting. My days as a MedLab student start at 8:30 a.m. and often end at 4:30 p.m. each day. Every day, it's jam-packed with lectures and various laboratory courses where theoretical knowledge turns into application of practical skills. Although the days are long, the community within the med lab cohort is what keeps me going. This is what she said about her career aspirations. Although the curriculum is designed to produce medical laboratory technologists, MLTs, who are skilled in all areas of the clinical laboratory, I hope to work in anatomical pathology. I have grown an interest in pathology in my undergraduate studies and hope to pursue further graduate studies in pathology to bring those extra technical skills to the clinical laboratory. And this is what makes her proud to be a future med lab professional. There is often a misconception that healthcare professionals who are not very patient-facing do not have an impactful role in patient care. MLTs play such an integral part of healthcare, which is often overlooked and unfamiliar to many. From early disease detection to disease prevention, MLTs have a crucial role in detection, diagnosis, and treatment. Up to 70% of all decisions regarding a patient's diagnosis, treatment plans, and other medical decisions are based on laboratory results that are carried out by us. It would be extremely rewarding to be an instrumental member of the healthcare team. And that is the statement from Joey Zhang.
So I'm going to talk a little bit about the admissions process. The best place to look for the program details is on our website. And the application period for this admission runs from October to May of next year. Our start date is September 2023. Again, we're a 2.5-year program, full-time in-person diploma. And check the website for the details about that. Next slide. So what are the steps? Get your paperwork together, do the online application. We have a Casper test and a mandatory questionnaire as part of that application process. The mandatory questionnaire is your opportunity to showcase your non-academic skills and accomplishments, and that is part of the requirement for the application. Casper is a third party. The test with them involves ethical, moral situations. So they're the kind of things where there aren't any specific right or wrong answers. And the Casper company evaluates the tests, answers, and sends us a score for that. And we consider that as part of your application material. There is a sample test available on the Casper site. We do encourage you to take that before you take the actual test. It'll give you a sense of the style of the questions they're asking and the speed that you need to be working at, and their test format. You do have to register to take that, that practice test. These are our entrance requirements and our preferred requirements. And again, you don't have to scramble to write any of these down. They are on the website. They're available to you. And then we'll have this slide deck and presentation available to you on the website also if you want to look at the rest of it later. Transcripts and documents, we strongly prefer them to be digital. We do not recommend that you mail in your transcripts. So we need your transcripts and then the mandatory questionnaire and the Casper test. So the admissions process, we are a competitive process. We don't evaluate any of the applications until after the window closes. So there's no difference between getting your application in first thing and getting your application in right at the end. As long as it goes in during the period when the window is open, we will evaluate your application after they've all been submitted. So once the window closes, we as a department create a short list of people that we would like to speak to. Once we've created that short list, we will offer a MMI, which is a multiple mini interview that is done online, that's done virtually, so you don't have to come onto campus for that. And the kinds of questions that we're asking don't require you to have any previous laboratory knowledge. We are asking about things that will involve you to pay attention to detail, convey information clearly, a little bit of critical thinking, that kind of thing. So it's not really much of anything you can put a lot of work into preparing for. And then after the MMI, the department will evaluate the MMIs in concert with your academics and your CASPER score, and we will select applicants and send invitation letters, and then you can pay the commitment fee, and the program starts in September 2023. If you do not get an admission letter after the MMI process, we do have a wait list, and we do usually end up pulling students from that wait list as people from the original set of invited applicants drop out for whatever reason they have. Laddering opportunities. So where can you go after our program? You'll get a diploma with us. There are a number of other places you can bump that up to a bachelor's if you wish, or other certificates within BCIT that can help you climb the ladder. So you can move from being a bench technologist, you can go into a supervisory role, into management, and the health leadership advisory certificate or advanced certificate will get you there. You can also move sideways into things like biotechnology or instrument technologists. So we have a lot of highly automated equipment. It needs maintenance, it needs care, it needs repair. Instrument techs are the ones that come in and help us take care of those. Again, we're in private labs, public hospitals, blood banks. We're all over the place, but we're behind the scenes, so you don't necessarily see us out in the public like you do with nursing and doctors and things like that.
Hi, everyone. Now, moving from the academics, I would like to let you know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of the student services are available to you as a prospective student, and others will be available to you once you become an enrolled student. Here are some of the important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I'd like to mention that we have a President's Entrance Award. Selection is based on academic achievement, but also volunteer and community service. Please contact financial aid directly for more information. BCIT is committed to providing assistance to students with permanent or temporary disabilities. If you have been accepted to a program and believe you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. Just a couple more that I'm going to mention, even though there's many more. But the two big ones are the BCIT Health Services is a health clinic located on our Burnaby campus. They provide medical care for current BCIT students year-round. We also have a counseling and student development department and recreation services, which includes a fully functional gym, a climbing wall, a racquetball court, and an open gym for drop-in and team sports. We consider recreation an integral part of our campus life and welcome all students to enjoy their services. If you have any questions about how to apply, or the application process, or anything to do with registration and application, please connect with our advising department. They accept phone calls, drop-ins, or emails. And like Emily said earlier, we will be forwarding everyone a copy of the slide deck and the recording, so you don't have to copy anything down. You will be getting it in your email. And our social media. So we're on Facebook, Twitter, Instagram, YouTube, and LinkedIn. So feel free to connect with us on any of those channels. We love talking to students. We love sharing posts. We often share things that our students are doing. If you have any questions about or want to know more about tours or our Spend a Day program, these are the links here. And at this point, I'd like to open it up to our Q&A. So Maninder, have you seen, is there any questions that are applicable to the group? It looks like you've been answering, the group has been answering questions as we've been going along, but if there's any general questions, I'd like to bring them up now.
Yeah, we've received a number of questions and we have been answering them. I'm wondering if anybody from the department would maybe like to speak a little bit on the selection process for the program. prior to that, I'm just trying to think of a question that I could answer. Maybe the one that we received early on about applying early. As mentioned, applying early is beneficial in the event that you maybe forgotten to submit a document, or there's a requirement that you're missing and you didn't submit the right transcript. It's beneficial in that case to apply early so you find out from our admissions department. However, you do have until the application deadline date to submit your application, as Emily mentioned. The selection process takes place after that deadline date. And so another question to follow up on that was about applying with midterm or final grades. If you will have final grades by the application deadline date, it's probably best to wait and then apply with those final grades. However, if you're fairly certain you're not going to have final grades by the deadline date, then please apply with your midterm grades. We want you to get your application in once you're ready to apply. Thank you.
Hi, everyone. I'll field the question about the admissions process a little bit. So just to build on what Meninder said, first step is getting your application in before the deadline. The second step, as per the BCIT MedLab Science website, would be booking your CASPER test. That would be the next step. And then from the review of your transcripts and the review of your CASPER test, which is at BCIT and not directly through the program itself, we would look at that, and those students that met the requirements and were the top students to interview. We always interview usually double the number of students that will be admitted to the program, and the students that are shortlisted would be the students that were offered the MMI. And of that first shortlist, we would have a second shortlist. We offer the MMI to more students than we admit into the program as well. I hope that answers the question.
Yeah, maybe I'll take another question. We've received a question about GPA a number of times as well during this session. We'd just like to let everyone know that GPA is just perhaps one factor of the selection process. There's many other factors that they're taken into consideration. So for example, what type of work experience, how well you do on the CASPER, the MMI. So we encourage you not to maybe get stuck on one aspect that we've listed under preferred requirements, but make sure that you're well-rounded, that you have a little bit of everything that the department is requesting. So we don't necessarily combine. I've received a question at the end here about how GPA is calculated for admission. The departments don't generally recalculate GPA. They look at the GPAs provided from your post-secondary or secondary institutions. If you look at the grades required for medical laboratory science, those minimum grades are already fairly strong grades that we're requesting students to have. That shows that you have knowledge of those pre-entry courses, and that has set you up for success in the program. So if you've achieved those minimum grades in the pre-entry courses, you're in a good position to apply and be considered for the program. So please keep that in mind.
We have a question from Elnaz. Is there any availability for international students?
Our program is not open to international students.
Thank you, Jennifer. One from Isabella Lynn. Is it recommended to do the challenge exams if I didn't meet the post-secondary requirement but met the high school requirement? And Meninder, you answered that, but if you could maybe speak to that for the group.
Sure. Is it recommended if I didn't meet the post-secondary? So there isn't a mandatory post-secondary requirement for this program. The minimum entrance requirements are from high school. And the challenge exams that we offer are for the high school subjects. So if you meet the requirements from high school, then you're not required to write the entrance exams. Just checking to see if I've missed anything on that one. So no, there's no required exams for post-secondary that you need to write for this program.
And maybe if one of the medical laboratory faculty could answer this question about how about volunteer? Is it mandatory to have before applying to be considered? And how are the volunteer and work experiences verified?
Me again, or Jennifer and or Emily on this one? Me? Okay. So as Maninder mentioned earlier, and I actually answered a question like this earlier as well, it's a holistic approach. So in my text to the individual that asked the question earlier, I had said that volunteerism is a gift back to your community. So in my opinion, and the opinion of the program, I think as a whole, is that it doesn't matter what healthcare program you're applying to, if you are giving back to the community, that is one of the attributes that any healthcare program would certainly consider as a positive in anyone's application. Is it mandatory? No, I wouldn't say that it's mandatory. And then part of that second question was more about GPA, but I think Meninder's answered that quite well in that it is a holistic overall approach. There are certain criterion that any healthcare program is seeking in its applicants, and we're no different than healthcare, any other healthcare programs.
Thank you, Donna. The tuition fee link is been posted in the chat. Are there any other questions that haven't been asked? Ooh, Dana, is it common to be the one drawing blood in this position?
Depends what site you are working at and what site you train at. You will learn phlebotomy as part of your competencies because that is part of our national certification scope of practice. So you will learn that here at BCIT. You will also get practice in clinical when you go out to your clinical environment in that skill. And if you take employment at a small hospital or even some of the regional hospitals, you can be assured you will be collecting blood. But if you're at a huge institution, then it's unlikely you will because they tend to have phlebotomy teams. So it depends where you end up. But as part of the program, you'll definitely leave the program with the skill set that you need to work at any of those institutions. Up to you where you go.
Thank you, Donna. Are university level courses that correspond to the program requirements valued to a greater extent compared to high school level courses? Maninder, do you want to take this one?
Yeah, I was going to ask Donna, but I could definitely take this question as well. I think we've sort of answered this question a number of times in different manner. It depends on the situation sometimes. So it's not just a black and white answer, but it also can be in that I hope what you can all take away from this session is that if you fulfill the minimum academic requirements, you're already in a strong position to be considered for this program. So in addition to the academic requirements, we're going to be looking at your MMI results, as mentioned, your CASPER results. So it's a holistic approach, as Donna mentioned. So don't get so caught up on just one factor of the selection process for this program. Post-secondary education can be helpful when it is a competitive, maybe competitive intake in which you're applying. So what that means is that if all applicants applying to the program have post-secondary, then having post-secondary yourself will put you into that competitive group as well. But once again, that's not to dissuade anybody who has the high school requirements from applying. And I'm not sure if Dawn, if you'd like to add anything further to that, or Emily.
If I could just poke in and say, we have a couple of high school students in our program every year, and they are often quite successful. Sometimes they have a little bit of a difficulty making the transition from a high school environment to more of a college university. It's a little bit less structured than high school, but they still do quite well academically, and they're very successful in their labs.
I was going to say the same thing, Emily. There's a little bit of a lag as getting used to the culture of post-secondary, but as soon as that lag is met, it is equal opportunity and fair learning for everyone. And because this is an applied science, if you do have post-secondary science courses, they'll support you in your academic studies in some capacities, but because it's applied science, there's a lot of other I guess there's intricacies in exactly how those skills will transfer, but we will make sure that everyone has the same opportunity to learn those applied skills. And in the end, we're here for you. If you're admitted to the program, we want you to be successful, and we will do everything in our power to help you get there.
have a question about breaks. So since the program starts during the fall term, what if I cannot continue my studies and take a semester break? Can I take the required courses for that level at a different time?
Not really. Our program is full-time running through, and if a student's unsuccessful in the course, there's an opportunity for them to reapply to that level, but there's no guarantee that they'll be readmitted because we have another cohort behind with that is a cohort of 96, and we have to commit to the clinical placement seats. So if you were to be unsuccessful in a particular level and reapply to that level, if there's no clinical placement seats available for you, i.e. there's been no attrition in the cohort that's following you, there would be no capacity to readmit you. I don't know if that answers the question.
And a follow-up question to that, Donna, is so there would be, is there an opportunity to take any courses during the summer? This is a different question.
No, this is really a cohort model. And so the 96 students follow together. So as Donna mentioned, if you weren't successful in a specific course, you know, we have to work with you to find a way to try and retake that, but it's not easy because it's a cohort model. It wouldn't be offered for another year, and it's contingent on if there was space available due to attrition from another student. And I think just tying that back, I want to state, I think, you know, what's kind of been shared by the program, we really are looking for, you know, students who are strong academically, but strong all around to enter this program. I know there was an earlier question about applicants. We generally have 2 applicants to 1 position, I believe. So it's we get a large number of applicants, but would encourage everyone, if you know, it's not just the person who's got the top GPA, their top this, we really are looking for people who certainly meet and exceed the minimum requirements, but who are the whole kind of you know, you have different elements to bring to the student. And so every student's going to be slightly different in the program, and students work together on their strengths.
Thank you, Jennifer. We have a question from Emma. This is a bit of a personal question, but I'm currently working to save money to fund my education and have no availability to volunteer in the field. If I'm unable to find work within the field, would this reflect negatively on my application compared to someone who is able to take that time to volunteer?
Again, it's a holistic process, but understanding that every student has their own journey and their own struggle. I would say what I've said, answering other questions in the past, don't make the decision for yourself. If you don't throw in your hat in the ring, you have absolutely no opportunity to be accepted into the program. So if you're interested in MedLab science, you are excited about work in healthcare, you meet the requirements as Maninder has stated and Julie and Jennifer have stated, put in your application and let the assessment unfold and take it from there.
I'm just looking at the question that's come up about timetabling. So the timetabling is set. You don't need to try and figure out the timetable. You'll be set into a group of students, and you'll be registered. The courses will all be registered. You don't need to try and get certain courses. Everyone who gets into the program will be into the courses that they require.
Excellent. Thank you, Jennifer. And with that, we're going to bring this session to a close. I don't see any more questions. Remember to check your email for a link to this presentation. And oh, thanks, Darren. And Darren put that same information in the chat. And you're also going to get a PDF of the slide deck. We have one more question from Emma about the 5-year recency. Would that include courses completed in 2017 June?
I can't quickly do the math, but if you're close, recency isn't hard and fast unless you're way outside of what is reasonable. So you can always put your application in or ask that it be reviewed by admissions, and they'll take a look at that recency requirement.
Thank you, Donna.
And if I, sorry, Julie, if I could just add to that, because the recency questions come up a few times. Keep in mind, the recency requirement is not only something that we're preferring, but it really more than anything, it's there for you to be successful in the program. So if you took, for example, biology 12 or what is now called anatomy and physiology 12 10 years ago, and now you're going into a program where you're taking higher level anatomy and physiology, you may be struggling and you don't have time. There's no time to make up and learn your biology 12 at the same time that you're taking the higher level course. So really having recent courses is more beneficial to you than anything else.
Our last question. Do all 96 students take the same courses at the same time? By that, I mean like the same classroom and lab.
Yes, is the quick and easy answer. So your lecture sessions will happen all 96 students at once, but we obviously can't fit 96 of you into the same lab space and work with you at the same time. So we split the cohort of 96 up into 4 sets, and your set will move through the labs as a group.
Wonderful, thank you. At this point, I would like to thank everyone for being with us today. We wish you all the best in your future in health sciences. Please connect with us, reach out to us, email us, find us on social media, make an appointment with program advising. We're here for you. So thank you again for taking the time out to attend this information session. And thank you to Emily, Donna, Jennifer, Darren, and Maninder for all attending and presenting. Thank you again.